Do you struggle with persistent redness, bumps, or visible veins on your face? It might be rosacea, a common yet often misunderstood skin condition. Many people think it's just blushing or sensitive skin, but it's so much more than that. And while it's not life-threatening, it can be really frustrating to deal with and can affect your self-esteem. In today's video, we'll dive into what rosacea is, its causes, symptoms, treatment options, diet tips, and precautions to help you manage it effectively. Rosacea is a chronic inflammatory skin condition that primarily affects the face. Now, I know some of you might be thinking, inflammatory? But my skin isn't always red or irritated, and you're right, rosacea can be tricky. It often comes and goes, with periods of flare-ups followed by periods of remission. But even when you don't see the redness, the underlying inflammation is still present. This inflammation affects the blood vessels in your face, causing them to dilate and become more visible. That's why redness is a hallmark symptom. But rosacea can also manifest as small, pus-filled bumps that resemble acne, which can be especially confusing. And to make matters worse, rosacea often gets mistaken for other skin conditions like acne, eczema, or even just sensitive skin. This misdiagnosis can lead to improper treatment and unnecessary frustration. It's important to remember that rosacea is a very individual condition. What triggers one person's rosacea might not affect another person at all. And the severity of symptoms can vary widely. Some people experience only mild redness, while others have more persistent and bothersome symptoms. Host. It's most common in adults between 30 and 50 years of age and tends to affect individuals with fair skin, but it can happen to anyone.
So, what exactly causes rosacea? Well, that's the million-dollar question, and unfortunately, we don't have a definitive answer yet. Research is ongoing, but it seems like rosacea is a complex condition with multiple contributing factors. One theory is that rosacea is an inflammatory disorder of the blood vessels. This means that the blood vessels in the face are more reactive and easily dilate, leading to redness and flushing. But why this happens in some people and not others is still unclear. Genetics definitely play a role. If you have a family history of rosacea, you're more likely to develop it yourself. It seems like there might be certain genes that make some people more susceptible to the condition. Beyond genetics, environmental factors also seem to be important. Sun exposure is a major trigger for many people with rosacea. The UV radiation from the sun can damage the skin and worsen inflammation. And let's not forget about our gut microbiome. Yes, the trillions of bacteria that live in our intestines. Emerging research suggests that an imbalance in the gut microbiome could also contribute to rosacea. Voiceover common triggers include sun exposure, hot beverages or spicy food, alcohol, stress, extreme temperatures. Host research also suggests that certain microscopic mites and bacteria on the skin may play a role in triggering rosacea. Rosacea is like a chameleon. It can manifest in different ways, making it even more challenging to diagnose and manage. Let's break down the most common symptoms so you can get a better understanding of what to look for. The most well-known symptom is, of course, persistent facial redness, particularly on the cheeks, nose, chin, and forehead. It might start as a tendency to blush or flush easily, but over time the redness can become more persistent and even develop a permanent ruddy complexion. Another common symptom is the appearance of small pus-filled bumps or pimples, often mistaken for acne. Unlike acne, however, these bumps are usually not associated with blackheads or whiteheads. As the condition progresses, you might notice small, visible blood vessels on your face, especially around your nose and cheeks. These are called telangiectasias, and they occur when the blood vessels become dilated and lose their elasticity. And if you thought rosacea only affected the skin, think again. It can also affect the eyes, leading to a condition known as ocular rosacea. Symptoms of ocular rosacea include dry, irritated, itchy or watery eyes, red or bloodshot eyes, and a feeling of grittiness or burning in the eyes. Voiceover. Rosacea can manifest in various ways, including 1. Persistent facial redness, 2. Small acne-like bumps, 3. Visible blood vessels, 4. Dry, itchy or irritated eyes, known as ocular rosacea, 5. Thickened skin around the nose in severe cases.
Now, you might be thinking, this is all starting to sound familiar. How do I know if it's just sensitive skin or if it's actually rosacea? Well, that's where seeing a dermatologist is crucial. Unlike some conditions that have specific diagnostic tests, Diagnosing rosacea is primarily based on a clinical examination and your medical history. A dermatologist will carefully examine your skin, paying close attention to the affected areas. They'll look for the characteristic signs of rosacea, like the distribution of redness, the presence of bumps or visible blood vessels, and any signs of ocular rosacea. But it's not just about what the dermatologist sees. They'll also ask you detailed questions about your symptoms, such as when they started, what triggers them, and if you have any family history of rosacea or other skin conditions. Be prepared to discuss your skincare routine, any medications you're taking, and your lifestyle habits, as these can all provide valuable clues. Diagnosis is usually straightforward. A dermatologist examines your skin and asks about your symptoms and triggers. In some cases, they might recommend tests to rule out other conditions like eczema or lupus.
How do we treat rosacea? There are effective ways to manage symptoms and keep flare-ups at bay. Work closely with your dermatologist for a personalized treatment plan. Topical medications are often the first line of defense. They reduce inflammation, redness, and bumps. For severe cases, oral antibiotics might be prescribed. Laser therapy can shrink dilated blood vessels. Although there's no cure, rosacea can be managed effectively. Always consult a dermatologist for the best treatment plan. We've talked about medications and procedures, but did you know that your diet can also play a significant role in managing rosacea? Now, I'm not saying that food alone will cure your rosacea, but making some dietary changes can definitely help to reduce inflammation, minimize flare-ups, and promote overall skin health. One of the best things you can do is to incorporate more anti-inflammatory foods into your diet. Think colorful fruits and vegetables like berries, leafy greens, tomatoes, and fatty fish, rich in omega-3 fatty acids. These foods are packed with antioxidants and other nutrients that help to combat inflammation throughout the body, including the skin. On the flip side, there are certain foods and drinks that can trigger rosacea flare-ups in some people. These are often the same triggers that cause flushing in general, such as spicy foods, hot beverages, alcohol, and even caffeine. Pay attention to how your skin reacts to different foods and try to identify and avoid your personal triggers. Voiceover. Did you know your diet can influence rosacea symptoms? Here are some dietary tips. Include anti-inflammatory foods like fatty fish, leafy greens, and berries. Avoid hot, spicy, or alcohol-based foods and beverages. Drink plenty of water to keep your skin hydrated. Reduce caffeine intake as it may trigger redness in some people.
Managing rosacea is a marathon, not a sprint. It's about making long-term lifestyle changes and adopting a consistent skincare routine that supports your skin's health. Let's dive into some essential precautions and skincare tips that can make a world of difference. Sunscreen, sunscreen, sunscreen. I can't emphasize this enough. Sun exposure is a major trigger for rosacea, so protecting your skin from those harmful UV rays is non-negotiable. Choose a broad-spectrum sunscreen with an SPF of 30 or higher, and apply it generously to all exposed skin every day, even on cloudy days. When it comes to skincare, gentle is the name of the game. Rosacea-prone skin is sensitive, so harsh products and ingredients can irritate it and worsen your symptoms. Avoid products that contain alcohol, fragrances, menthol, or other potential irritants. Instead, opt for gentle, fragrance-free cleansers and moisturizers, specifically formulated for sensitive skin. Look for ingredients like ceramides, hyaluronic acid, and niacinamide, which can help to soothe, hydrate, and protect the skin barrier. Host, managing rosacea isn't just about treatment, it's also about prevention and skincare. Here's what you can do. 1. Use sunscreen daily with SPF 30 or higher. 2. Avoid harsh skincare products with alcohol or fragrances. 3. Opt for gentle, hydrating cleansers and moisturizers. 4. Manage stress with practices like yoga or meditation. 5. Keep a trigger diary to identify and avoid your specific triggers.
Rosacea can feel overwhelming, but with the right care and awareness, you can manage it effectively. Remember, knowledge is power. The more you understand about rosacea, its triggers, and the available treatment options, the better equipped you'll be to take control of your skin's health. Don't be afraid to experiment and find what works best for you. Keep in mind that rosacea is a highly individual condition, and what works for one person might not work for another. Be patient, be consistent with your skincare routine, and don't hesitate to reach out to a dermatologist for guidance. Post-rosacea can feel overwhelming, but with the right care and awareness, you can manage it effectively. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more health tips. And remember, healthy skin starts with the right knowledge and habits. See you in the next video.
Stay healthy, stay confident.